Welcome to our channel dealing with all types of viral stories and answers to day-to-day questions. This is not medical, psychiatric, legal, or any other type of advice.
Have you ever looked in the mirror, stuck out your tongue, and noticed a white layer covering it? For many people, this can be surprising or even worrying. A white tongue may look unusual, but in many cases it is harmless and quite common. At the same time, it can sometimes signal an underlying health issue. So what exactly causes the tongue to turn white? To understand this, we first need to understand how the tongue normally works. The top surface of the tongue is not smooth. Instead, it is covered with tiny structures called papillae. Among them are the most common type, known as filiform papillae. These are small, hair-like projections that give the tongue its rough texture and help it move food around while chewing. These papillae constantly grow and shed cells as part of a natural renewal process. Normally, this cycle keeps the tongue clean and healthy. But sometimes that balance gets disrupted. When the papillae grow longer than usual, or when dead cells do not shed properly, the tongue's surface starts trapping materials, such as food particles, bacteria, and proteins from saliva. Over time, these trapped substances form a thin coating on the tongue. When light reflects off this mixture of debris and keratin, the tongue appears white. In other words, what you see as a white layer is often not a single substance. It is actually a combination of bacteria, dead cells, and food debris forming a living film on the surface of the tongue. Another important factor in keeping the tongue clean is saliva. Saliva constantly washes the mouth and helps remove particles that might stick to the tongue. In addition, the simple act of eating, especially chewing fiber-rich foods, creates natural friction that helps clean the tongue during chewing. However, when saliva flow is reduced, this natural cleaning system becomes weaker. For example, dehydration can make saliva thicker and less effective. When the mouth becomes dry, debris sticks more easily to the tongue, creating a noticeable white coating. Diet also plays a role. People who eat mostly soft or mashed foods may experience more tongue coating because these foods do not create enough friction to clean the tongue during chewing. Another common cause of a white tongue is poor oral hygiene. If the tongue is not cleaned regularly, bacteria accumulate between the papillae. Some of these bacteria produce sulfur compounds as they break down proteins. These compounds are often responsible for bad breath. That is why a coated tongue is frequently linked with halitosis. Lifestyle habits can also contribute. Tobacco use, whether smoking, vaping, or chewing, can irritate the tissues inside the mouth. In response, the tongue may produce extra keratin as a protective reaction. This thickened layer can give the tongue a grayish or white appearance. Alcohol can make the situation worse because it dries the mouth and reduces saliva production. Another factor that many people overlook is mouth breathing. When someone breathes through their mouth, especially during sleep, saliva evaporates more quickly. By morning, the tongue may appear dry and coated with a white film made of proteins and dead cells. While many cases of white tongue are related to lifestyle or hygiene, infections can also cause it. One common example is oral thrush, a fungal infection caused by Candida species. Candida organisms normally live in the mouth without causing harm. However, when the balance of microorganisms changes, the fungus can multiply excessively. When this happens, creamy white patches may appear on the tongue and other parts of the mouth. These patches often look similar to milk curds or cottage cheese. Unlike some other white lesions, these patches can usually be wiped away, but doing so often reveals red, inflamed tissue underneath. People with oral thrush may also notice a cotton-like sensation in the mouth, reduced taste, or a burning feeling while eating. Certain conditions increase the risk of this infection. For example, antibiotics can disrupt the balance of bacteria in the mouth, allowing Candida to grow more easily. Corticosteroid inhalers used for asthma may weaken local immune defenses in the mouth if the mouth is not rinsed after use. Individuals with weakened immune systems, such as those with uncontrolled diabetes, cancer treatments, or HIV, are also more vulnerable. Dentures can also create an environment where fungus grows more easily, especially if they are worn overnight or not cleaned properly. In some situations, white patches on the tongue may represent a different condition known as leukoplakia. Leukoplakia refers to thick white patches that cannot be wiped away. These patches often develop as a reaction to chronic irritation, such as tobacco use. Although many leukoplakia patches are harmless, they are considered potentially dangerous because some cases can eventually develop into oral cancer. Certain warning signs require special attention. For example, white patches that contain red areas, develop a rough or wart-like surface, or persist for long periods should be examined by a healthcare professional. Other symptoms, such as persistent ulcers, unexplained bleeding, or swelling in the neck, also need medical evaluation. The tongue can sometimes reveal signs of other diseases as well. For instance, the infection syphilis may produce grayish-white patches in the mouth during certain stages of the illness. Because these lesions can resemble other conditions, syphilis is sometimes called the great imitator. Another condition affecting the tongue is oral lichen planus, an autoimmune disorder where the immune system attacks cells in the mouth lining. This often appears as delicate white lines or lace-like patterns on the tongue or inside the cheeks. There is also a harmless condition called geographic tongue, where patches of the tongue lose their papillae and form smooth red areas bordered by white edges. These patches may change shape and location over time, creating a map-like appearance. Medications can also influence tongue health. Certain antibiotics, antiviral drugs, and blood pressure medications may cause tongue discoloration or inflammation. Many medications also cause dry mouth, which increases the likelihood of a coated tongue. Nutritional deficiencies may play a role as well. Low levels of nutrients like vitamin B12, folate, or iron can affect the health of the tongue surface. When the protective barrier of the tongue weakens, infections and coating become more likely. Hormonal changes and metabolic conditions can influence tongue appearance too. For example, diabetes may increase sugar levels in saliva, providing an ideal environment for fungal growth. Fortunately, in many cases, a white tongue can be improved with simple daily habits. Cleaning the tongue regularly is one of the most effective steps. Using a tongue scraper or a soft toothbrush to gently remove debris can significantly reduce the coating. The recommended technique is to start near the back of the tongue and move forward with gentle pressure. Staying well hydrated is equally important. Drinking enough water supports healthy saliva production and helps the mouth clean itself naturally. Diet can help too. Foods rich in fiber, such as fruits and vegetables, create natural friction during chewing that helps remove debris from the tongue. Reducing excessive sugar, alcohol, and coffee may also support a healthier balance of microorganisms in the mouth. Simple rinses made from salt water or baking soda solutions may soothe irritation and help loosen debris. In recent years, researchers have also studied oral probiotics, which introduce beneficial bacteria into the mouth. Certain probiotic strains can help reduce harmful bacteria associated with bad breath and plaque. Even with these measures, some cases require professional care. If a white coating or patch lasts for more than 2 or 3 weeks, it is important to seek medical or dental evaluation. Healthcare professionals may examine the tongue, perform tests for infections, or in rare cases take a small tissue sample to rule out serious disease. Ultimately, the tongue can act as an important window into overall health. Most of the time, a white tongue simply reflects everyday factors, such as hygiene, hydration, or diet. But occasionally, it may signal infections, immune conditions, or other systemic problems. Regular dental checkups remain one of the best ways to monitor changes in the mouth and detect potential issues early.
So the next time you notice your tongue looking a little white, remember that it may be simply your body reminding you to drink more water, maintain oral hygiene, and pay attention to your health. Your tongue, after all, is not just for tasting food. It is also quietly telling a story about your well-being.
Thanks for watching. Please like and subscribe. Visit again.